Brown baby, brown baby, as you grow.
Hi, I'm Greg Eugene, and welcome to On the Couch. Let me explain a little bit about the couch. I have a dear friend, and how we came up with the concept. A dear friend of mine and I, we talk pretty regularly on the phone, but what we do is, before either one of us start, we say, well, who's on the couch? And a group of friends of mine here in Boston decided that might be a nice concept to unpack some of the concerns and phobias that exist around same-gender loving men. So indeed, there's a poem that a dear friend of mine shared with me, and I want to share it with you. I am black, I am gay, I sure didn't choose to be this way. A double whammy, a curse is what some folk would say. Labels blocking you from seeing me, looking for the differences rather than the similarities. Hut, 2, 3, 4, I fight for you, I die for you, I serve and protect. Hallelujah, you shout as I play the piano and as I sing in the choir, and yes, as I preach my sermons. Ooh. You marvel at my knockouts, tackles, touchdowns, dunks, and home runs. You read my books and sing my songs. I teach your children reading, writing, and arithmetic. I am everywhere. I do and feel everything. Just like you, and yet your hatred and my fear keeps me chained and locked in the darkness of the closet. See me crying, see me dying, see me. In 1994, she was invited to speak at the United Nations Conference on AIDS. She was asked whether it would be appropriate to promote masturbation as a means of preventing young people from engaging in riskier forms of sexual activity. And she replied, I think that it is a part of human sexuality and perhaps it should be taught. This remark caused great controversy and resulted in elders losing the support of the White House. White House Chief of Staff Leon Panetta remarked, there have been too many areas where the president does not agree with her views. This is just one too many. Elders was fired by President Clinton as a result of the controversy in 1994. She was the 15th Surgeon General of the United States. And so with that, we are going to join in on the couch as we unpack some of the phobias around talking about sex.
So, I don't know if you remember that incident with Jocelyn Elders.
I do.
You do? Yeah.
What was interesting about it is that she was a very outspoken, very good Surgeon General.
Mm-hmm.
And she was a woman. So I think the combination of her being a woman and a black woman and openly talking about sexuality just at the time really freaked out the country.
Mm-hmm.
That was one
Couldn't handle it.
Right.
But it brings to mind when you were the keynote speaker at the Bayard Rest and Breakfast. I know that you are CEO of the Multicultural AIDS Coalition, and you were asked to speak at that breakfast. And I remember you talking once about, or towards the end, that black men needed to talk more about sex. And I was wondering if you could expound upon that a little bit.
Sure. Well, you know, black men are one of the groups that are most affected by HIV in the country. And this was a breakfast focused on HIV in communities of color. And one of the reasons I think that that's a big issue, particularly among gay and bisexual black men, is that we don't talk about sex or sexuality. And in some cases, we don't have a good knowledge about sex and sexuality and the ways to protect ourselves. And I think that comes from a lot of things, but in general, we have an overall issue in the black community, I think, of being open and embracing of sexuality. I mean, there's a long history of why that is, and abuses that our people endured during the whole history of slavery. But we've had a hard time getting out of that space where we feel comfortable and free to talk about sex, and therefore are able to have a healthier attitude and to stay healthier when it comes to sexuality. So that's what I was talking about, and I was specifically focusing on the gay and lesbian community at the time, or gay men for that particular conversation.
Yeah. Well, I mean, just talking about sex in general is sort of uncomfortable. I think...
I don't think it has to be, though.
Well, no, it doesn't have to be, but as it stands, as it appears now, even just asking parents to talk to children about sexuality, taking birth control, using condoms, and so on and so forth, that seems like it's a very difficult subject to address. I mean, when you look at some of the current TV shows, it seems as though the responsibility always goes to the mother to talk about sex with children.
But that's because where's the father at?
Yeah. Well, even the men would defer to the mother, and so I don't know exactly. Maybe we can talk about why that is. Why is it so difficult for men to talk about sex and sexuality?
I think Jamal makes a good point, though, when we talk about black families and how they exist today, and a large number of families of young men growing up in families where there's not a father present. And that, I think, has an impact on how people think about sex, how they're willing to talk about sex, you think?
Well, also I think within the hip-hop culture, we're always talking about sex. It's always about who you're fucking or whose pussy you had last night or whatever. So I think a lot of times you have two different worlds that you have to function within. Because in one sense, you hear all this stuff in the media, in the radio, on television, in movies, etc. Sex is very just thrown around. But when it comes to coming home to your family and discussing the more intimate value that maybe sex should have, the value that sex should have in general, I don't think that comes from the mainstream media, hip-hop culture, and what I feel young people are really influenced by. Yeah. So maybe it may be a value system that is not set in place. Because if you're not hearing it at home and your only exposure to it is through what mainstream media is showing you, then are you really going to prioritize it in terms of putting it at something, putting it at a level of importance where we're talking about health, or do you relate it to HIV and AIDS, or do you relate it to you just loving yourself and taking care of yourself?
Yeah. Well, I was going to say, it seems to me like when you learn about sex through the mainstream media, it cheapens it. Mm-hmm. I think learning it from home, learning it from your parents, I mean, that is done out of love and genuine care, and it's done with the purpose of protecting their children, Right. And still, there's some discomfort about, well, how soon should we talk to our children about sex? And I don't know. I think it really just depends on when the situation presents itself. Right.
There's an old joke about that Australians will tell you about how back a long time ago when people left England, America got the Puritans and they got the prisoners and the criminals. Yeah, yeah. And so they have a much more open society than we do. And I think that's really important. I mean, America overall has we're very restrained when it comes to publicly talking about sexuality. We have a whole industry, huge industry of pornography and sex that's not talked about. But I'm thinking about myself, I think one of the important things is that you have to be able to talk about human anatomy from the very beginning. I mean, I think we grow up, people who grow up with all kinds of nicknames for their body parts automatically have some notion that there's something shameful about the fact that you have a penis or a vagina. And I know that my mother, who grew up in a dirt road and a population of 300 people, but was a smart woman, valedictorian of her high school, I learned the word penis and vagina and uterus from her mouth. Mm-hmm. So I never grew up having nicknames for things. And when I first heard them, I was like, what does that mean? And so as I'm learning about sexuality, either in school a little bit, I went to Catholic school, so I had a little bit of class on homosexuality. But at least the framework was, this is a perfectly natural thing. There's nothing to hide.
Right.
You know, there's nothing wrong with your body parts. And you need to know how they work and how they function, and need to know when there's something wrong. And so that's sort of a basic framework from which we need to start. And then I think we need to basically not be afraid of talking about sexuality. I mean, people are sexual beings, and people are going to have sex. And children are going to grow up to be sexual beings, and we can't pretend that that's not going to happen. So I think we should try our best to make it a healthy transition to the point when they're adults. And only then, I think, will young people be able to make decisions that are smart. If they have knowledge and they know more about themselves and about their sexual organs and about their bodies, then they can make choices that are informed, and they aren't afraid or don't have guilt about, I shouldn't be doing this. We all know that just telling people not to have sex doesn't work.
Right.
It's probably the worst kind of prevention you could have.
What is it? Abstinence?
Abstinence.
Just say no?
Just say no.
But where does that education come from?
Right.
I'm wondering, should it be done in the school system, or should it be at home?
It should be both.
I
I think we have a public health interest to make sure that we have comprehensive sex education in schools. And I think kids have a civil right to understand sexuality and understand their options and how to protect themselves. Now we can discuss when that starts, but again, kids need to be gradually learning about human anatomy and sexuality from an early age. And when it's appropriate, particularly when they're going through puberty, we need to make sure that kids understand what's happening and that they have enough information and access to people who will give them information. And I know that's controversial with some parents who want to have complete control. And I think, ideally, we would have parents having full, complete conversations with their children. But in this day and age, when we see young people, particularly young black men, particularly young black gay and bisexual men, who are the most impacted by HIV disease right now. They're the highest, the fastest growing population of people becoming infected with HIV. Even though they aren't necessarily having more sex than other young people or doing anything that makes them out of the norm. It's just that the disease has impacted the population so much that among that cohort there's a lot of HIV. And so it's really, to me, unacceptable to not give these young people the information that they need to save their lives, really.
Yeah. Well, I was reading an article, and the feeling was that some people do not use condoms because it's a sign of weakness. Either it's the one who normally contracts the virus is the doee, not the doer, and so therefore, it's okay for me to have sex because I'm the top and I do it all, and then you have the one that's the receiving end, and that's the one who, if they get, and so they've added a label to who should wear a condom, who shouldn't. They've added this whole thing of virility, with being the person who has all the sex. You're talking about in hip hop, the person who has more sex is the more of the jock person. But in all these situations, risky sexual behavior exists, and you're really putting a loaded gun to your head when you don't think about wearing condoms. So, I mean, how do you reach the hip-hop population? How do you reach men who have this ideology or this idea in their head that, it's okay to be the doer and not the doee and all that kind of thing?
But I think we're not even talking about the prison system as well. I mean, we have to engage a discussion of the disproportionate number of black men and Latino men that are in prison.
Yeah.
And then how does that also play a role in what we're talking about? Because